Good morning, AlphaFlo friends. This is Kelly, and today I'm here with Dr. Jennifer Miller. Dr. Miller, thank you so much for being with us.
Thanks for having me.
Yeah, so you're on the East Coast out in Georgia, and I'm so excited to talk to you today because you do so many fascinating things. Can you give us a little bit of background about your history and your practice?
Yeah, sure. So I have been a veterinarian for 20 years now, and I spent my first 8 years in a strictly equine practice. And then I added in animal chiropractic and acupuncture training and slowly morphed my practice so that now I only do what would maybe be called alternative therapies, but certainly the chiropractic and acupuncture play a huge role in it with some other body work. My practice is mostly sport horses, about 30% sport dogs, and the rest of it is a handful of geriatric small animals and some show cattle.
Wow. Well, we love your holistic approach. You may know our founder, Dr. Ginger Johnson, is also a
Yeah,
chiropractic neurologist on the human side. And
and
there's
I
such
have
an incredible
yeah.
integration with the animals. So we are just so excited about what you do. So tell us a little bit about the agility dog world. We're excited to learn about that.
Yeah, so agility dogs are almost exactly the same as sport horses. So the agility world, there are a ton of people that did hunter jumpers and other horse sports before coming to agility. And the funny thing about agility is we we worry about exactly the same thing. So when we're training our dogs, we're working on jumping form and jumping style. We worry about surfaces, just like in the horse world. And the biggest difference between horses and dogs jumping is that in our agility courses, sometimes the dogs actually have to jump towards us and go around the wing of the jump and jump towards us. And so instead of horses don't have that physical capability to wrap their bodies around. So they basically can take the jump from the front, but the dogs can take a jump from any position around. So those tight wrapping turns put strain on a dog's body, as do some of the other obstacles. So there's a lot of taking care of sport dogs to keep them in prime competition form. And it's only really recently that there has been a push towards canine sports medicine. So very few boarded sports medicine canine doctors in the country. We happen to be lucky enough to have one within a 2 to 3 hour drive of the Georgia area.
Wow, that's fantastic. Well, all of that makes sense. Are the dogs being judged on time? Are there obviously time, but other things as well?
So agility is just like the jumper ring. It's get in, go as fast as you can, complete all the obstacles, and get out in as quick a time as you can.
Okay, so speed is important.
Yes,
Excellent. So you have a personal dog,
I do.
Lore, that
I
is an
do. I have
agility dog. Tell us
Yeah, she's
about
a
that.
6-year-old English Cocker Spaniel that I imported from the UK. And she is full of drive and a super fun dog to run. She had an incident last spring where she got herself bound up in a tunnel and came out not quite right. So pursued immediate diagnostics with musculoskeletal ultrasound and diagnosed with bilateral iliopsosas insertional tears. So that put an end to our competition for quite a while. It takes a long time to rehab those.
Right. Okay. So obviously you're not treating your own dog as some, doctors don't treat their own children. Who is
Right.
your personal vet?
So my sports medicine vet is Dr. Britt Benson. She practices out of the South Carolina area.
Okay.
Yeah.
And so then you were introduced to AlphaFlo. Tell us about that.
So my introduction to AlphaFlo is actually more through the horse world. Many of my patients get referred to equine sports medicine vets and are treated with the equine side product Renovo. So when she was injured and I was looking at treatment options, I was already super familiar with how well Renovo was working in my horse patients. And so contacted Ginger about the AlphaFlo, did a little investigation and decided that that was the product that I really wanted to use in her to help her healing.
Excellent. So tell us how that went when she received the dose of AlphaFlo.
Yeah, so her healing really followed a pretty good path. She had a slight re-injury in July and a few more doses of AlphaFlo, and she's been back in training since August. I was super happy with the follow-up ultrasounds after the injections. And I think it was the first time Dr. Benson had used the product, much to my insistence. I think she was pretty happy with the healing rate also.
Excellent. Yeah, we know that this is a newer product, even though Renovo has been using over 12,000 horses. The AlphaFlo came out in December. So we're, 10, 11 months in, and we haven't had thousands, but we've had hundreds of successful cases. So we love to hear the brave ones who are willing because it honestly is do no harm with an Amnion product.
Correct.
Yeah.
And that's what to me, it was a choice to have kind of a known entity over repeated PRP injections, just because you don't know exactly what's in the PRP. And I can have data about exactly what I'm putting in cell wise and cell quantity wise in the AlphaFlo product.
And so for the veterinarians who are listening, what would you say to them in comparison, for example, PRP to AlphaFlo?
Again, with my N of 1 and AlphaFlo, I'm pretty excited about it. I think, and especially in talking to some small animal sports medicine rehab vets, that an off-the-shelf product with a known amount of healing factors, if you will, is really the way to go. For me, I always wonder, if a dog gets injured, if a horse gets injured, how good is their PRP? And certainly there are plenty of studies on PRP, and I'm not downgrading PRP, but I did like the ability to know what exactly I was putting in the dog.
That makes sense. So how's Laura doing today? She's been training since August.
Yep, she's doing fabulous. We are 2 weeks away from our first trial back, and hoping that that will go well for us. And as long as that goes well, we will attend the European Open AKC team tryouts in December. So fingers crossed for a successful trial in a couple of weeks, and then off to Pennsylvania we go.
Wow. Well, we are definitely going to follow along. We're excited to see how she does. We're excited. Is this an Olympic sport, agility training?
No,
okay.
It's not. I've heard that there's a little bit of a push to make it that way. The interesting thing about agility is there are multiple different organizations that host trials. So as opposed to, say, USEF, FEI type things, I think there are 1, 2, 3, at least 6 organizations in this country that host different agility venues. So then trying to pick who would kind of be the one would be difficult.
Okay, that makes sense. Well, we're excited to continue to introduce AlphaFlo into the agility world, just like Renovo was really known as the go-to for the equine sport.
I really think that it'll be a benefit to our dogs.
Awesome. Well, Jennifer, are there any closing words that you would say to anyone listening?
The biggest thing to me is I was impressed with how my dog responded to treatment. I am not personally doing the injections in my own pets, but have referred 2 or 3 of my patients already to another local practice who I introduced to AlphaFlo, and they have been doing some geriatrics with arthritis. It's a little early to tell how well they're going to respond. Those dogs were treated about 2 to 3 weeks ago. And I'm super hopeful we can get them some good comfort in their later years of life. So I think the product has a lot of applications, and I'm excited to start exploring them with the patients in my practice.
Absolutely. Yes. We're so excited about what this regenerative product can do for the geriatrics. I personally have used it in my 18-year-old dog, and it has extended the vitality of her life. She was arthritic, and wow, what a difference.
Excellent. It's such a neat way that's absolutely not harmful to hopefully get these guys some comfort in their later years.
Yes. Well, Dr. Jennifer, we so appreciate your time. We're excited to continue following you and Lauren and some of the other patients.
Thanks so much. I appreciate it. It's good to talk to you.
You too. Thank you.